Hi, this is Dr. Paul Zeitz. If you're anything like me, you're overwhelmed by this state of the epidemic, this extended shelter-in-home order that we're living under, and the fire hose of information that's pouring in, and the amount of misinformation and fake news that is also pouring in as well. As an experienced epidemiologist, working on infectious diseases like AIDS, TB, malaria, and the hantavirus, meningococcal outbreaks earlier in my career, I've taken it upon myself to diligently track the epidemic and the response here in the United States and globally as we all are trying to handle this COVID-19 pandemic. So as you know, there are different kinds of masks out there. There are the N95 masks. I have one just to show you. These are urgently needed by our health workers and our frontline workers. So it's not recommended that these masks are used when you go out in public. There are surgical masks like this that are also in short supply for many of our health workers. Although in this area here in Maryland, I have seen a lot of people in the public using these kind of surgical masks. The other kind of mask is the homemade mask and the cloth masks. You can use bandanas or other scarves or cloth masks. It is recommended. A cloth mask like this has 3 layers, and you can insert coffee filters or other devices inside of these masks and wear them like this and put them around your face, making sure you're covering your nose and your mouth. Making sure you're covering your nose and your mouth. I think the masks are really important for several reasons. One, you can, if you are an asymptomatic carrier, you can stop transmitting the virus to other people. It also may reduce your ability to get infected if someone around you has it. What I've noticed for myself is that when I'm wearing a mask, I'm more attuned to the social distancing, and other people also walk away from me. Maybe they think I'm infected or something. But I think by having the mask, it's more, I see that social distancing is happening more rigorously. The social distancing and the sheltering in home is being done for 3 main reasons. One, to protect yourself from getting infected and your family members. The second main reason is that you're reducing person-to-person transmission in the community, and you're helping protect your neighbors and your community members who may be vulnerable to severe illness. And the third reason is that by reducing community transmission at this critical time, you're going to be reducing the number of people that get very sick and that have to go into the hospital. And so as we already are seeing in New York and North Jersey, the hospitals are getting overwhelmed. They're running out of personal protective equipment. They're tight and short supplied on the ventilators. And so as these hotspots start peaking, you can see in real time why the social distancing and the sheltering in home is so important to reduce the burden on our healthcare systems. She asks, what do you think is a realistic time frame for ending the shelter in home? I am worried people think we'll be fine by May 1st. Thanks, Donna, for your question. We've been talking about this kind of question since I started the live chats a couple weeks ago. As you know, the federal government has recommended strongly that there will be shelter-in-home orders in place through the end of April. And I think that we're going to have to see how that goes. But it's very likely, in my opinion, that that will be extended into May, if not through the whole month of May. We're seeing that the epidemics are starting to intensify, and we are hoping that they will peak and then start to flatten down. There are models that are out there from different sources, and the models are not agreeing right now. It's sort of like the weather models. You know how you go onto the weather and they're predicting this or that, and then it changes as the data gets clarified, and then sometimes the models aren't right. And sometimes we get a bigger storm, and sometimes we get nothing. Well, I can say for sure that we're not getting nothing. We're having a massive pandemic here in the United States from COVID-19, where we already have nearly over 13,000 people that have died in a very short period of time. The models are flipping around right now. We could have peaking in April in many places, but it will be geographically different. So, for example, New York City and North Jersey are peaking now, and Maryland isn't supposed to peak until later in April. And different parts of the country, we're just seeing the rapid increase in number of new cases, so they're still peaking. They're still on the upswing. So we're going to see a lot of variation in when the epidemic is peaking. And so I think it's hard to predict exactly how long shelter-in-home orders are going to be in place. The other variable that we have to track very carefully on the shelter-in-home orders is the testing system. So as we know, testing is now more available than it had been a month ago, but it's still hard to get tested in some places in the country. So in places where there are hot zones or hotspots, the testing is being limited for healthcare workers and for people that are in hospital settings. And so the people in the community that may be showing signs and symptoms of COVID-19, many of them are still not getting tested. So I think there are new tests that have been approved by the FDA and that are being rolled out nationally that are the rapid point of care tests. But those systems are not up and running yet. And so I think there's a lot of work going on to try to expand the rapid testing to determine infection. And until we have that up, we won't really know what's happening with the transmission at the community level. The idea is that we get through this first wave, and by the end of this first wave, which I hope would be wrapping up by the end of May, then we can have a testing system up and running by then so that we can identify new cases that are occurring, and we can go back into a containment approach where we identify cases quickly, we do contact tracing, we isolate those cases quickly, and we limit or eliminate community transmission. We missed the window on that on this first wave, and we're seeing community transmission happening across the country. And so we're hoping, and I'm hoping, that we can make progress on the Test the People campaign where we can get a testing system up and running. I've seen great proposals coming out of academic and thought leaders, public health experts working on a national surveillance system. I've heard progress being made within the government about establishing this kind of system. So I think the planning is underway. The ideas about how to do that are being developed. There hopefully will be another legislative package going through the Congress where a national surveillance system can be established and funded by Congress. And I hope that that will happen during the week of April 20th when Congress returns to session. And so the progress on designing and implementing that can happen relatively quickly. We can build that national surveillance system off of the influenza surveillance system. We have the testing, rapid testing tests that are now available and up and running. They just need to be set up around the country. So I think we've made some progress. It's not set up and working perfectly today, but over the next 6 to 8 weeks, I can see that that could be happening and that we could have a national surveillance system. So as this first wave declines, hopefully by the end of May, then if we have a national surveillance or testing system up and running, then we could switch into a containment strategy where we can identify cases quickly, isolate them, do contact tracing, isolate any positives, and then contain the spread of the virus in the second wave. The other part of that is antibody testing. And there is a huge amount of work going on to develop new antibody tests so that people that have been infected already, that may already have antibodies to the virus, we can know that, they can know that, and then they could be available to return to work or to be returning to meet essential services like the frontline health workers. So those tests are being developed, and there's an intensive effort underway to do that. I think there's an important quality control step when you develop antibody testing. That work is underway by our medical researchers and by our federal agencies that have to review and approve those tests. It took a decade for that to happen with the other epidemics, like the HIV epidemic. Now we're seeing things happening in weeks and months. So the pace of medical research and technological development is very fast. I know it's not fast enough for all of us who want to get out of our houses, but I'm amazed by the progress and the rapidity and the velocity that some of this stuff is happening in the COVID pandemic. The collaboration across research centers, both here in the United States and around the world, is unprecedented. There are open data portals, they're sharing research information, they're publishing pre-reports before they go through peer review even. And it's an amazing amount of collaboration that's underway to make progress on these critical issues. We've heard a lot about this combination of drugs from our White House Coronavirus Task Force, and what I can tell you is that the early indications are that it may be working, and I can tell you that there are clinical trials that are underway right now. The only way to know is to do a clinical trial. You can hear one story here that it worked. You can hear another story here that it didn't work. You can hear a story here where someone died from taking chloroquine. So you're hearing a wide range of anecdotal stories, and that's where medical science has developed a very clear pathway to determine the efficacy and safety of drugs in this situation. So I'm happy to let you know that there are clinical trials that are underway in New York City and in different parts of the country, testing to see whether hydroxychloroquine and the Z-Pak are beneficial. And I believe in science, and I believe in data, and I believe that this drug is being used. What I've heard anecdotally from physicians is that using it early onset of respiratory distress, when you have shortness of breath, may be an indication that these drugs may be most effective at that point. Once people are already going into severe respiratory distress, or what's called acute respiratory distress syndrome, the ARDS, when they have a collapse of their vital organs, that these drugs are not as effective at that point in the process. Again, that's just what I'm hearing through physician contacts, and all the physicians are waiting for the results of the clinical research trial. Those trials are going on here in the US, but they're also going on globally. So we're learning a lot. There are over 300 clinical trials for a wide range of drugs. There are anti-Ebola drugs that are being studied. There are antiviral drugs that have been used for HIV that are being studied to see if they're effective against COVID-19. There are nutritional supplements that are being recommended, like vitamin D, vitamin C, zinc, which may be beneficial for people to strengthen their immune system. Those vitamins, vitamin D, vitamin C, and zinc, have also been shown to be beneficial with other viral illnesses and in terms of strengthening your immune system. If you have specific questions about that for yourself, please contact your doctor and ask for their advice about whether or not you should be upping your dose for vitamin D, vitamin C, and zinc. I think I'm taking all those vitamins right now at the recommendation of my physicians. So I do think it's valuable to explore what would be appropriate for you in terms of strengthening your immune system.